people don't want to be on a drug forever, especially it's expensive drug. Food as medicine is really becoming a thing now. So this is where the opportunity is.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with my friend Victor Penev, CEO and founder of Edamam. Victor, great to see you.
Oh, good to be here. Always excited.
We've gotten to have this conversation about the business you're growing many times, and yet times keep changing. So give us the 2024 version of where Edamam is at and what the last years looked like.
Oh God, a lot happened in the last year. So a couple of things. Food as medicine is really becoming a thing now. I've been talking about it for a very long time, but now there is actually here at Health, there is a food as medicine pavilion. A lot of companies, both on the grocery and the healthcare side, are going there. So that's one. Alongside that, GLP-1 showed up, which kind of stirred the pot on a lot of things around food and how we deal with that. And then, of course, there's generative AI. So last year was very exciting because a lot of new opportunities opened up.
It's just been one of those things. Food as medicine, it's been this idea people believed in, and then they just didn't get catalyzed into action. So it's interesting that GLP-1s plus ChatGPT stirred the pot last year. Let's talk about GLP-1s. What's the opportunity and what are the challenges that you see in this turning point?
Absolutely. So GLP-1, the opportunity is that people don't want to be on a drug forever, especially it's expensive drug. There is some side effects, whatnot, people cycle out. But what health plans, employers, and ultimately the people taking the drug want is to have some kind of way to know what to eat before if they have to get on GLP-1, then while they're on GLP-1, what they should eat, high protein, high fiber, et cetera, and then when you get off the drug, what you should eat. So there's a few distinct places where food is important to kind of go through the consumer journey. So this is where the opportunity is. The challenge is there's no real business model yet. It's not clear who is going to pay for that. People think
the nutrition side.
On the food as
got it.
Companion to GLP-1s. Is it health plans? Is it the pharma companies that are selling the drugs? Is it grocery stores? Who's paying for that? This business model is being figured out now, but there's definitely a demand. And we're already working with companies like Noom on, GLP-1 companion recipes,
Okay, so Edamam, you are democratizing food data. Tell me about the platform.
Well, we are a data company, and we've probably accumulated the largest database of food and nutrition in the world. We have over 1 million foods, 5 million recipes. They analyze and tag for every nutrient, every allergen, lifestyle diet, chronic condition, meal type, dish type, cuisine, et cetera, et cetera, et cetera. What's important is not, there is a lot of breadth in the data, but there's a lot of depth in the data. And the other thing that really distinguishes is the data is very accurate. So accuracy of data is important if you want to do data. And the other thing that's exciting around this data is that over the years, we've compiled so much deep, accurate data that now we can use that to fine-tune small language models, train AI agents, et cetera, using our proprietary data. So that's another exciting thing that's happening.
Okay, let's talk about the business models, because just a second ago you said the desire for food as medicine, the wave is cresting, and yet we're still not quite sure who's going to pay for it. So given your understanding of the market, if you could wave a magic wand, who would you like to see pay for? What business model do you think could work?
Right. So there is the utopian version of that and the more realistic version of that. The utopian version of that is the consumer pays for it. Right? It doesn't go through the healthcare system because there is a lot of inefficiencies in the healthcare system, a lot of pricing problems, so people end up paying a lot more. And ultimately, GLP-1 is really a few cents to produce. It's a peptide that's very natural. So utopian version is you get them very cheaply. Everybody takes GLP-1 because it's cardiometabolic health, et cetera, or not everybody, but a lot of people do. And then there is food as medicine companion, and people really heal through food. The more realistic way is that some combination of health plans, pharma, and or grocery stores are going to foot the bill, and it's going to be free to consumer. That's going to take time to sort itself out.
What's it going to take to convince those bigger payers that there are long-term benefits, cost savings, all of this good stuff will come if you invest up front in that preventative health through food?
Well, they are all about health outcomes, right? And GLP-1 on its own can have amazing health outcomes. So there's got to be extra effort to be said about, okay, if you combine it with food, there is long-term sustainability of the health outcome. That requires time, because to prove that on top of the existing health outcome, it's not that easy, and there's no like a randomized control trial that you can do for food, right? It's very hard to do. So there's a little bit of a leap of faith that they have to do that this really works. There's some interventions, like Geisinger has done some studies around food as medicine interventions with lowering an LDL, A1C, BMI. Those studies have been done. This is for independent food as medicine. In combination with GLP-1 is going to take some time. But the other thing that I think that's going to convince them is that consumers are asking for it, right? They don't want to be paying huge amount of money every week, every month to just keep on the drug. They want to be able to get off the drug and continue with the weight loss that they've, seen, or, the better outcomes and whatnot. So that's where it's...
Does it strike you as strange that there is such a lack of research and evidence around food as medicine, given, I think I read a statistic that 80% of chronic diseases could be managed through nutrition. Whatever the number is.
No, I think it's 100%.
Okay, but whatever it is, it's a lie. 90, whatever. So you just said it's a leap of faith. Why isn't more money going into studies around food as medicine?
Follow the money. That's the problem. So there's two things. One is doing a control trial for food is very difficult, because you have to have a control group, and you cannot regulate what people eat across the board every day.
You give a call. It's good, theoretically.
Unless you put them a controlled environment.
Yeah.
Put some people, a group of people for 6 months in one place, group for another month. It's almost like, doing a mouse study, which doesn't work in real life.
Yeah.
People are not going to volunteer for that. So that's just doing the study is hard. And the other thing is the outcome of those studies is going to be eat much more vegetables in a raw format. There is no industry behind it. There is no big broccoli, right? Not big cauliflower, but there's big pharma. So if you follow the money, nobody's going to fund that, because the result of that is, okay, well, farmers should get paid to, for health. And, the pharma industry is not as organized as the farmer industry is not organized as the pharma industry. So
it's just one of those great gaps in the market. Like you just said, there's no big broccoli. We know the value of vegetables. It's like we know the answer. The industry doesn't have the business models to pay for it. What's one thing you could see changing what's one change that you could see that would flip that script and change things?
I have big faith in people. So the reality...
Power of consumers.
Yeah, exactly. So people are starting to become more and more cautious. There's a lot being said about in the last few years, and people are starting to change, and they're actually demanding better food, cleaner food, less ingredients in packaged foods, etc., etc. But where my real hope lies is in Gen Z. Because unlike millennials, Gen Z, this is one of their top priorities. They're willing to pay premium for foods that are clean, sustainably sourced, organic, even regenerative, etc., etc. So when Gen Zs grow up to become the paying generation as opposed to their parents, I think things are going to change. And a lot of the food companies know that, because they see that happening, and they're starting to change their formulations. I think that's going to become obvious for healthcare as well. But it's probably another 5 to 10 years out.
Okay. It's a long play. What should we be excited about for Edamam? What's coming next?
Oh, I'm excited about a lot of things, but one thing that is really exciting, our vision has always been like 50-year vision. Let's build a virtue nutritionist that's always with you, knows exactly who you are, knows your blood chemistry, your DNA, what you like, what you dislike, what your family is like, and can recommend in real time, non-intrusively, the right food for you to eat or cook or order, etc. And I always thought data is the way to solve that. Now, what's happened with generative AI, that vision has become a lot closer, because generative AI creates the interfaces for that easy recommendation, virtual nutritionists in the cloud and whatnot. So what I'm excited is that I think we're probably not more than 5, maybe at max 10 years, to a place where a agentic system of AI agents that do analysis of what you eat and recommend what you should eat, etc., orchestrated, are able to kind of mimic a virtual nutrition. So everyone's going to have their own virtual nutritionist. So I'm excited about it.
Just last week, I was telling my wife, I'm like, the kitchen is where I want AI the most sometimes. You know what I have in the fridge, you know what my health is. Like, that makes so much sense. And what I think is so interesting is that it's not so much the technology behind ChatGPT and generative AI, but the way that it became part of the public consciousness. So now people think of the ability to
absolutely.
talk to an AI agent.
Anybody here that use ChatGPT, I'm sure that 99% of people hit
So now potential adoption of a generative AI nutritionist skyrockets.
Right. I mean, there's a lot to be solved in terms of accuracy, hallucination. I mean, our approach is actually not to return data from the large language models. We use them to have the intuitive interface, but then we actually call our API, so we have deterministic, really high quality outcomes for meal plans or meal recommendations, et cetera, et cetera. But there's a lot to be resolved still to get to that place where it will work. But absolutely, I think it's going to happen.
Awesome. Well, Victor, thanks for taking the time. Give me a little update. You know, we'll keep checking in. We'll keep watching. I feel like you've been on this steady drumbeat, and it's been fascinating that this year was such a big turning point. You can't always know when that's going to happen, can you?
No, but I think next year is going to be like that. I mean, this is really penetrating.
Yeah,
the consciousness.
Exciting.
And it's becoming mainstream. I mean, just look at around here. Noom is sponsoring the app. Kroger is sponsoring the.
Yeah.
So those are companies that are not traditionally thought of as healthcare companies.
Fascinating.
Food as medicine is where they're going.
All right. Keep up the good work.
Thank you so much.